hospital is very crowded. The hospital is filled with referral patients and their families. Nursing and the other medical personnel collaborate to create conditions conducive to patient comfort. Long lines of queue welcoming the arrival of new patients and staff on duty this morning. Harmony exists between them. At the nursing station, the nurses were discussing. Some were doing handovers and counseling on senior nurses. Not only nurses, several doctors were also seen in discussing with nurses about the patients they were working with. The discussion looks very conducive, considering that the medical personnel do their job professionally.
Good morning, doctor.
Good morning, nurse.
Introduce, I'm Nurse Regy from Internal Medicine Ward. I called you this morning about the patient that come in overnight.
Yes.
I was just wondering if I could bring you up to speed and maybe talk about a care plan. If you have a moment, please.
Well, please explain the condition about patient. Nurse Regy conveyed all the data she got during the data review to Mr. Rudy very clearly. It appears that there is close cooperation among patient, nurse, and doctor.
Okay, thank you. Mr. Rudy is a 62-year-old man who was presented by a probable pneumonia. He was brought in by ambulance this morning around 4 a.m. Feeling unwell with a fairly rapid onset of shortness of breath and sets of 90% on room air, but he is presently stable. By way of background, he is generally well-man with no significant past medical history. He is on antihypertensive medication, only he is a non-smoker and a social drinker.
Okay, I got it. And then, what's about his blood pressure?
On examination, his heart rate was 112, his blood pressure down to 110/60, his systolic usually runs 150, and he said some 90% as I said before, but he was actually febrile and they couldn't hear anything on his chest because he was so tachypneic.
What's about the urine? Is the urine smooth?
He's not putting out much urine and it looks cloudy to me.
Yes, I got you. His current body temperature?
His temperature's 37 Celsius. He looks pale but not uncomfortable. For a slightly elevated white cell count chest X-ray was patchy but it was a mobile film down in the emergency department. We excluded an MI with an ECG that just showed a sinus tachycardia and his CO2 appearance were negative. But he does actually have this history of just coming back from a long driving holiday couples of days ago. So, the overnight med red thought that he might have a pulmonary embolus inside of him and some therapeutic saying.
Then, how's the patient now?
Now, this morning he looks a lot more comfortable, sets 96% on 2 liters of oxygen, but his CTPA was actually normal. So I reviewed him again, and well, since admission, he's actually developed a cold right-sided chest pain and a fever. So I think he's got a pneumonia even though he doesn't present with any history of fevers or recurs. So I'd like to repeat his blood test, get a formal chest X-ray. I think he should be only beyond prophylactic Clixon and I'd like to start some antibiotics as per guidelines. I'm worried about him. I think he needs to be seen. Would you like me to order some labs? Maybe send his urines for culture?
Yes, sounds like he could be getting septic. Let's prepare to get him the lab immediately. Send a urinalysis with culture, chemistries, and a CBC. So that's your plan?
Yes, if that's okay with you.
Sounds right, as his first X-ray being reported.
No, not yet.
Call me if the next X-ray shows has anything unexpected.
Yes, sure. Thanks, doctor. And I'll call the lab to confirm.
Yes, let's get in there. Nurse Regy and Dr. Adliah walked quickly to the patient's room to check the patient's condition. They walked away, leaving the bursting nurse station that's still under control. They looked worried but do their work professionally, while occasionally greeting some of the patients who are practicing walking in the hallway of the hospital.